Okay, good afternoon again from sunny Kuala Lumpur. Great weather out there, and I'm sure that you guys had a great morning. And certainly, the rest of the day beckons us. Welcome to the Kuala Lumpur Startup Summit, and we have the HealthTech panel session 2, entitled Medical Professionals in the Digital Age. And today joining me is an exciting bunch of panelists, right, coming from across multiple startups, and they'll be sharing their perspectives, thoughts, and ideas on how medical professionals, or rather the broader scope of healthcare professionals, right, be it nurses and pharmacists and physios and the whole bunch of people out there, cope as well as thrive in this new norm that we are that's upon us. So joining me today is Azran Osman-Rani, Dr. Khairul, Dr. Kev, and Zhen Wei. I'm not going to get into their details because I'll leave the pleasure for them to explain a little bit about their work, as well as introduce themselves and go on to a little bit about the topic. But quick round of intro from me. I'm Maran Virumandi, CEO of DoctorOnCall. I stumbled upon healthcare about 5 years ago and realized that there were really vast room of opportunities to improve accessibility and affordability and the quality of healthcare. And it's been an exciting ride over the last 5 years, and I'm definitely looking forward to what holds in the future. So let me start off with giving the floor over to Azran, right, to go on and introduce himself and the kind of work that he does, and we'll go in a round robin session with the rest of them.
Sure. Well, thank you very much, Maran, and good afternoon, everyone. At Naluri, over the last 3.5 years, we're trying to solve the issue of how do we provide care differently to make it much more effective and much more accessible through 3 ways. Number one, we've got to go beyond just transactional and reactive models. Reactive means you wait for a patient to come to you. How do we identify them early on and engage? And transactional means it's just per consultation or per prescription, per treatment. The reality is 70% of the conditions today, the chronic conditions, can't be solved with a single consultation or treatment. So we need a structured and programmatic approach to dealing with that. The second challenge is healthcare has become so siloed and specialized, right? If you see a cardiologist, she's going to talk to you about your heart. You see a gastroenterologist, it's about your gut. You see a psychologist about your mental health, or a dietitian about your diet. But the reality, again, chronic conditions are deeply interrelated, especially when you think about correlations between depression and diabetes, anxiety and heart diseases. So we want to challenge the model of siloed specialist care to bring multidisciplinary care in a way that's very accessible and convenient. And third, we need to challenge the way healthcare gets measured and compensated, from one where you get paid per consultation or per treatment to one where it's paid per outcome, because that's what matters, right? And healthcare payers are frustrated that they're paying more and more every year. Healthcare expenses are going up by 10 to 20% every single year, but yet people are still getting sick. So that's why we have to reimagine the way care gets delivered, especially in emerging markets where there's simply not enough healthcare professionals. And so simply one-on-one conversations like we're doing right now, if I'm talking to you, I can't talk to anyone else, is inherently limiting. And so we want to reimagine that way the care is delivered. So a little bit about us.
Oh, fantastic, Azran. Sounds really exciting. And over to you, Dr. Khairul.
Assalamualaikum and good afternoon to all panelists as well as audience outside. REMEDi has started our journey back in 2012, mainly to really solve, while Azran was talking about, changing the paradigm. We were really solely focused on connecting 3 main parties, namely patients as a center of our, effort. Secondly, the healthcare providers, and the third party is the healthcare funders. And how do we choose to actually do this is to connect them through an innovative electronic medical record platform, which we have invested quite a lot of time to ensure that the research development on our platform is robust. That goes to the reason why we were taking about 6 or 7 years to making sure that It's on the cloud, number one. So when we started off, we were one of the first few people who's looking at the cloud to solve this problem, because I think that's the only way that we can connect patients, healthcare providers, and healthcare partners in one platform. Secondly, we have also ensured that this EMR is compliant to all medical laws as well as regulations involved. And we have also ensured that the data sovereignty belongs in the country it resides. So in our case, it's in Malaysia. And as we talk a bit more later on, as this session progresses, you will see that we have also has entered a few other markets outside of Malaysia as well. Now, and thirdly, of course, this is, in the end of the day, the whole objective as the company is to really save lives, because I've worked myself on the ground in the emergency department, and bulk of the reason why we cannot efficiently deliver our healthcare services is mainly because of data is not available at the right time, at the moment, and for the right person. So these are essentially what we have done. And with this strong foundation that we have, we are now building verticals. Namely, we are in clinics now. We are also in occupational safety and health discipline. We are also in screening, whether it's for NCDs or the current COVID as well. And we are also both sides of the divide, whether it's government or private. So we are currently on both sides of the fence. So essentially, that's pretty much on REMEDi side. I don't want to take so much time early on. So back to you, Maran.
All right, fantastic. And just for the people who are new into health tech, when Dr. Khairul refers to EMR, electronic medical records, basically patient health records that are in this case in the cloud, right? So over to you, Dr. Kev, a little bit about yourself and how.
Yep. Yeah, good afternoon, everyone. So thanks for DoctorOnCall for organizing this wonderful event, and thanks, Maran, for moderating this. So a bit introduction about myself. I'm Dr. Kev here, medical doctors by professions, have around 7 years of experience working in government hospital, and particularly very passionate about doing pediatrics. So the reason that I came out to start this company, QueueMed. QueueMed was started around 3 years ago, together with my co-founder, Dr. Tai. The main reason that I came out is because of my own medical, my daughter's having some medical conditions back then. And that's the reason I need to spend more time with her, brought her for a lot of. I agree, both Azran and Dr. Khairul mentions there's a lot of pain point in the healthcare facility to be solved. I mean, Maran also, there's a lot of things to be pinpoint. But the things that frustrate me a lot is when I brought my daughter for a lot of follow-up, both in the private and healthcare, private and public healthcare facility, is the long waiting time. That frustrates me a lot. Like morning 9 o'clock appointment, the whole day will be gone. You cannot find parking. Very poor patient satisfactions, and that is I think the main reason that we start QueueMed, Q for medical, and to test these kind of solutions. So in terms of how we're gonna address this solution, we actually provide a very comprehensive end-to-end patient journey. Before patient come to the healthcare facility, they can book appointments online, and not just book the appointment through single platform, but through multiple platform. They can book through even MySejahtera, even the KK or the clinic's social media platform, their website, multiple platform, even other startup player. And on the appointment day, patients can get a queue number online. They can check the queue number using their mobile phone, so they can actually see how many patients in front of them, how long estimated waiting time. And of course, after consultation with the follow-up, teleconsultation, follow-up, e-payment, basically we provide this kind of end-to-end journey. And what QueueMed do the best also, we actually help the doctors to adopt this kind of digital solutions. So coming from a doctor's background, we speak the same language or the healthcare provider. So this is how we put our solution in their feet and help them to adopt this kind of digital solutions. I think that's all for now. Thanks. Pass back to Maran.
All right. Thank you, Dr. Kev. Hope your daughter is doing a lot better now.
Yep.
Minor episode over there. So over to Zhen Wei, for you to explain a little bit about your venture and how do you guys work with medical professionals.
So at ThoughtFull, we're actually a digital mental health company, and we work largely with the mental health professionals. So we are actually providing a platform where users can connect to the mental health professionals to receive, daily bite-sized coaching on mental health. We actually have a lot of tools that is also, co-created, designed by these mental health professionals to be able to leverage science-backed frameworks to be able to, build resilience over time. our key focus is really, achieving our vision to make mental health as aspirational as physical health. Because in us, in this region, mental health always comes with this stigma, and there's the help-seeking behavior is really just not there, right? On top of that, there's actually a lot of fragmented and friction in the conventional way of engaging with the mental health service. So we are really here to think about how to really then solve the problem of making it approachable, accessible, and making sure that people are able to have access to mental health as easy as having a thoughtful chat. Yeah.
All right. And so thank you for that. And what I wanted to do was just pick up from there, right? And if I can start with Dr. Khairul, right? If you can just talk to us about post-pandemic, right? What is the single challenge or opportunities that's facing the working life as well as the professional growth of the healthcare professionals, right? Just jump into to tell us, like, if there was a single challenge or opportunity, what would it be for the healthcare professionals out there?
I would approach it in two ways, since we are involved in some of the clinics facing financial difficulties to really transform their businesses, as well as healthcare professionals working in the front lines with regards to fighting the pandemic. The first one is so the challenges that clinic face is when they have a brick and mortar setup, right? So you are waiting for patients to come in, which is no longer the case right now. If it's lockdown comes in, how the patient comes to them? And hence the reason why we have equipped all our clinic management software clients with a virtual clinic. So technically patients can come to their clinic, whether it's it's a pre-appointment base or just walking in digitally through the platform, through the patient portal. And we're rolling this out not by ourselves alone. We have other partners who are picking up the bits and pieces together with us in order for us to give this challenge or to defeat this challenge together with the healthcare clinics. Yeah, that's number one. Secondly, with those fighting the pandemic up front, what I think we have envisioned this much ahead of time, whereby they have no single data that they can actually refer to, right? Some has its data that have to refer to, some depends on the central government or federal ministry to provide them data, and some of them are rolling out themselves on the ground to really get the data accurate enough, right? And since we are involved in this, we are changing how they actually flow the data from patient screening of COVID-19. And if they were to need, quarantine, or they would need to home assessment at home, and how does the healthcare providers or the doctors at the respective state, district level monitor them. So we've streamlined all these processes for them. And this is why I like you mentioned, Maran, it's a single problem that we have managed to solve for them. Mm-hmm. And I'm glad to say that starting from tomorrow, there's another 10 more klinik kesihatan is going to use our platform to really manage this screening to patients who needs home quarantine. Because let's face it, despite vaccines is just rolling out, people are, before we get to that phase 3 where the masses are going to be vaccinated, this infection is not going to come down by itself. It doesn't mean that vaccines roll out equals to people not getting infection anymore, right? So while the effort is scaling down on this effort to track, trace, as well as isolate and treat, we should not just discount the fact that we still need to tackle this efficiently while the vaccination effort is picking up. So that's the 2 points that I think the problem as well as opportunity that come to us. And in fact, we have been the busiest since the lockdown comes in last year March.
All right. And so Dr. Kev, just to jump into you, right, because you got significant experience rolling out in klinik kesihatan, picking up from where Dr. Khairul was talking about, what are now that the whole bunch of them are going online with some of your solutions out there, how do you see that helping the healthcare professionals over there? Is it, are there challenges, are there opportunities? Maybe you can just name one or two of them.
Yeah. Thanks, Maran. So yeah, as mentioned, that one of the pain point they face by healthcare provider are actually looking at both public and also private. Public side, clinic kesihatan, they are the one who facing a lot of problem during the COVID pandemic, because clinic kesihatan is not one of, they are the busiest medical center in Malaysia. One day they can handle 1,000 to 1.5 thousands of patients every single day, and those patients are the one who have some CKD, chronic disease, basically they all have some underlying medical conditions which make them very vulnerable for the complication of COVID pandemics. So there is a reason that actually we have to come in. Actually, QueueMed have been endorsed by Ministry of Health to provide this kind of online appointment system for clinic kesihatan. So the main reason we want to apply this kind of solution is to help them to maintain social distancing, so there will be less congestion, so that social distancing can be displaced and can be implemented there. So when you're talking about the pain point that the clinic kesihatan are facing, I will say that the resources is not so equally distributed among the nationwide clinic kesihatan. Certain clinic kesihatan, especially in the KL area, Selangor area, they have certain basic internet access. They have certain basic hardware, computer. Maybe they have one in the reception counter, one in the front desk there. But you talking about the clinic kesihatan in the rural area, for example, in Negeri Sembilan, we have deployed to even up to Sabah, Kelantan, Terengganu. Certain area they have they find very much difficulty in adopting this kind of digital solutions. So for us, actually, the main point we want to bring out is we have to make our solutions very relevant to their circumstances. So there's also one of the reasons we push out for admin app. So those clinic kesihatan who don't have enough hardware, who don't have enough laptop or computer, at least the nurses, the doctors can even use their handphone to operate. At least they can manage their patient better. And second point is clinic kesihatan, like what you mentioned, Dr. Khairul is been pushing electronic medical record. So electronic medical record is something to make the entire operations become more efficiency. For example, your patients, one patient come into your clinics, you want to know the patient's past medical history. If you don't have the electronic medical record, how are you gonna do? You have to go back to the medical storeroom, and you can spend 1 hour to locate that particular patient's hard copy of the medical record. Then only you can give a very proper consultations and management from there. So in terms of clinic kesihatan, there's still a lot of clinic kesihatan actually are manual. You don't be surprised, even some of the clinic kesihatan in Kuala Lumpur area, they don't even have electronic medical record. You're using this kind of hard copy. So I do see there is a lot of potential. There is a lot of pain point to be tackled in terms of the healthcare ecosystem, both in the private, both in the public side. Yeah.
All right. Okay. And just to change tack, right, to Zhen Wei, tell us, right? I mean, I suppose you're dealing with a lot of, mental health professionals, be it counselors or psychologists or psychiatrists. Maybe you can shed some light on that and tell us a little bit about, what are the challenges and opportunities that they faced in adopting or going digital?
Yeah, mental health professionals they're probably hit harder than some of the mental health some of the medical professionals out there, because the conventional way of them having consultation is most of the time 1 hour and face to face, right, with one-to-one kind of situation, which is not ideal in a pandemic situation, right? So when the pandemic hit, there are actually a lot of limitation in terms of how they can actually go and see people, right? So the way we have done it is that because the digital approach that we have done, the way that we have actually augmented the way they engage with their clients, we're able to actually help them to reach their clients that they otherwise would not have met, because we are also focusing on the prevention side, which means to say they're able to actually meet much more of the quote unquote of the market, where people may not be ready to actually engage with a full-on counseling session, but are actually having mild or moderate symptoms around mental health, and they were able to actually then engage with their clients online and without being at risk in person, right? So the other other thing is around, for example, is exactly like what you mentioned around, adopting the digital tools, for example, right? So mental health services, largely, I think it's not a secret that, it has still been in more of a manual way of doing things. Like, for example, you're still having a lot of, records that are actually fragmented and things like that, right? So we're actually helping them to provide training in terms of how to actually run their, and a lot of these mental health professionals are micro entrepreneurs as well, right? So having a system where they are able to actually track, prioritize, and being able to have these tools where they are able to engage their clients without having to meet them face to face are the things that we are proactively building together with them, so that they're able to actually then thrive in this community of mental health professionals that are trying to move to the digital age, right? So we put a lot of emphasis around building community, and they are one of the most caring and dedicated people, right? They really want to see their clients improve, and we are very, very fortunate to be able to kind of co-create all these digital tools and ways to engage with their clients that they otherwise would not have the opportunity to do so in this pandemic season, right? Yeah.
Fantastic. And Azran, I wanted to pick up a little bit from your intro earlier, right, in which you talked about changing the paradigm and focusing more on health outcomes in terms of just, typical sick care, right, which is, as you mentioned, transactional, very episodic, and it's not going to really move the needle in terms of dealing with a lot of the chronic conditions that we are facing upon us. So how is that going to reshape the entire relationship with doctors, right? From their curriculum, training, incentives, business models, and in the way we interact as a platform or as an organization that has an umbrella of 1,500 doctors under them, or healthcare professionals. How's that going to be reshaped in the future?
Well, thank you. Imagine a world where, the value that you create is based on results, not just the activity that you do, right? So, for example, right, like if you are a chef, right, should you be rewarded for just simply cooking, or actually the quality of the end product, right? Like if you are building a house, do you get paid for designs, or just kind of, this is what I'm going to do, or actually the final product? So same thing, right? I think it's time that we move from transactional or episodic care, where you're paid per activity, per consultation, to this is my patient. I'm, taking care of this patient for whether it's 6 months, 12 months, or possibly longer. And my success in helping that patient achieve predetermined quantitative health goals will lead to the compensation model that I get. And that could be, for example, if it's weight loss, it's a 5% weight loss. If it's an HbA1c reduction, it could be a 1.0 HbA1c reduction, because these are measures where the payers, the insurers, the employers can put into models and say, okay, that equates to a 30% risk of diabetes reduction. That's about a 5,000 ringgit a year value. So out of that, how much do I get paid for that, right? So it really is about, moving the industry towards being accountable for outcomes, rather than just simply giving consultations or prescriptions.
Fantastic. And I really am now very interested to get the two medical professionals in our room over here, Dr. Khairul and Dr. Kev, right? In light of what Azran just said, right? You're gonna change from effectively from pay per consult to pay per performance, right? And he's gave very clear KPIs, right? You drop your HbA1c, drop your weight, stop smoking, whatever the stuff is, and you get paid from that. But you guys have gone through years of med school, probably a master's program, and worked out there boondocks at the coal face, right? In the line of fire, in clinic kesihatan, dealing with 200 patients a day per doctor, and sometimes 1,500 a day. How's that going to be for the medical professional over there? I mean, how do you have to reshape your healthcare? Your med school, and also reshape your clinic kesehatans or clinics over there. Dr. Khairul?
It's a big question to answer. I mean, if I were to be a minister, I would scratch my head already, right? So,
Vote for Dr. Khairul.
I would like to break this question down to the simpler way of addressing this. Number one, I think the paradigm shift of doctors or medical professionals to adopt all this digital tool must be something that is being exposed early on. And I think the younger doctors, when I do my onboarding with either klinik kesihatan or the private GPs, some of them waiting their HO rotations, they adapt very, very well. I mean, you don't have really, walk together with their hand. I mean, you just show them a bit and they are off. And they need to, I think they are embracing this, but the fact of the matter is the powers that be or people who's at the administration side would also have to embrace the same way, right? You can't be doing things in silo if the soldiers down below is really struggling and you're at the top not giving the right tools for your soldiers to win the war. Definitely is not going to be something win-win situation. So that's only one aspect of healthcare services, right? This is not even talking about healthcare compensation as what Azman mentioned. That's a mountain of tasks to move, and I think Azman is moving it bits by bits. I don't know whether I am contributing to him or I'm all for it, to be honest with you. And that's the reason why we are providing a connected medical records across healthcare providers, patients, as well as the healthcare funders as well, right? So the funders, we need to know what the clinics or the doctors who serving them is giving the patients or their workers the bang of the buck. I mean, as the saying goes, right? I want you to be enrolled in this program, and me as an employee, I do not need to know who you are, but I just need to know as a company, my health of my workers are improving. We're doing that in a few projects that we're doing in, right? So because we directly involved with clinics and the outcomes is something that we are looking at for. But whether or not the industry will move fast to get this outcome-based compensation, that's something that we will have to work on. I mean, definitely we have to work on. But I certainly would love if this is the case. And I think medical professionals as well are pretty much right now with the healthcare or their malpractice insurance hike is going up. This is even more difficult to get this going on. I mean, at least that's from my point of view in terms of compensation. And the rest of other things in terms of how to get this off the ground, I think if I were to delve into that discussion, we would just finish everything just on
We'll
that,
pass that to Dr. Kev then. Dr. Kev can pick up the time when he was dating with his future wife back in med school and and the stuff that he should be learning to make it more outcome based.
I would take it from the other perspective. I call it personalized care. So I was coming from a pediatrics faculty. My wife also a pediatrics master student. So in pediatrics, right, we actually trained to follow up with the same patients for a very long time, from when he's birth until he grow up 1 year old up to he go to school. So we actually focus on a lot of follow up, focus a lot of their growth, their outcome. So it's actually built in our spirit. Being a pediatricians, we have to take care of every single thing. So in compared to adult medicines, you can see adult medicine, they divide into adult neurology. You have one subspecialty, you have cardiology, another subspecialty, skin have another subspecialty. But being a pediatrician, you almost manage every single thing by your own. So that is what I'm looking at from my perspective. I think that is a correct way to go. Just that when you go out to the adult healthcare, even more silo. So I think what Azran is doing and what Dr. Khairul is doing, I think is definitely fantastic. But again, when you talk about adult healthcare funding, who is the payer, that is the thing we need to really sort out nicely. So and hot topic will be something like the national health financing, been talking about for the past decade. We are not sure when it's coming up, and if that's thing coming out, I think it can make this kind of personalized healthcare more comprehensive, more accessible, I believe.
Can I just add, Maran? I think because this is groundbreaking, so to speak, right? We believe the idea is not to create a platform, because a platform, a middleman, you have no control over the quality of the healthcare professionals, right? In our case, we hire them. They are our employees, our own psychologists, our own dietitians, pharmacists, etc., because they have to be trained to work with a completely different protocol. And therefore, we are taking that, if you will, that balance sheet position, right? To say, look, we want to be compensated based on the outcomes that we deliver. So you have to actually be in control of the healthcare that's delivered, not just being a middleman.
Okay, and so Zhen Wei, right? I mean, my personal experience has been that I stopped smoking, started hitting the gym, and also, you know, started adopting a really good dietary habit due to some intervention from clinical hypnosis, right, as well as some counselors, right? So I am a big believer of the fact that half the battle, or more than half the battle, is actually won in the mind. And since you're running a platform for mental health professionals, what thoughts if the incentive schemes for those guys were to actually be tied into actual outcomes?
Yeah, so I think that's something we are actually striving to do as well. I think not only from the perspective of the well-being of our clients, but also that, you know, the clients that we work with demands it, right? Stereotypically speaking, when it comes to mental health services and, you know, mental health consultations and all that, it has always been like, oh, it's a little bit qualitative, you know, it's not very quantitative, and so on and so forth. But there is a way to do this, right? So the way we've designed our interventions, and every time we actually, although we do function like a platform, but the way we've actually onboarded and you know, train our mental health professional that comes onto a network is that there is actually a framework that we've designed and based on science to be able to actually guide that behavioral change, like what you've described, like for example, in terms of, you know, being able to build healthier habits around either, like for example, being able to, you know, cope with stress, anxiety, or depression. The other side of the marketplace is the same, right? I think Dr. Khairul mentioned about, you know, being able to actually also change the mindset of the practitioners. So the way that we've designed the way we reward our mental health professionals is to also reward them for being able to follow certain protocols that we want for our clients as well. Of course, the way we've designed the framework is not so restrictive in a sense that, you know, it's a cookie cutter and a one size fits all, but there are actually logical checkpoints and milestones, things that our clients need to do in order for them to achieve a certain behavioral change and better outcomes, right? So we do actually, you know, try to create that kind of system where, you know, at the end of the day, it's not so much of achieving what Azran has mentioned, you know, overnight. We're taking baby steps and jabs at it to be able to also help our mental professional understand that there are ways to get used to that and eventually, you know, make bigger and more meaningful discussions with the payers and the investors that this actually can be done in a more meaningful way down the line as well. So that's what we're trying to do in our space.
I think if you don't mind, Maran, I add on. I think throughout the discussion that we have, I mean, especially for this topic, I think a key missing, I would say, I mean, a key that is missing is actually the patient's participation in all this, right? Whether it's mental health, whether it's outcome-based, you know, I mean, medical intervention. So patients' interaction with the healthcare providers or the doctors or whether it's psychologists, psychiatrists is a key element that is always missing when the doctors, you know, or any of the healthcare providers approach these patients. And I think this is where I think REMEDi is also trying to get back this data to patients to see for themselves how are they progressing, right? So this is, you know, because when they walk out of the clinics, I just got to know, I just did medicine, but apparently what happens, you know, really is really missing. And for patients to really understand what's going on, it's really helpful for them to get better. I mean, this is at least one thing I think should be emphasized as well.
Yeah, absolutely. As we are doing this as well, what we are doing differently, obviously, is also because we are a digital company, is we're providing the mental health professionals with the data points that, you know, the different progress that they've made on the platform to assist the mental health professionals to be able to make those judgments as well. Yeah.
Okay, fantastic. So right after this call, I'm going to be asking Azran and Zhen Wei to give me a quote on how to get a six-pack. Right, I hope you can keep it under.
It's cycling, Maran. When are you going to join Khairul and I for our 100-kilometer bike ride?
All right. Okay, I'll
bring
think
you to
about
30
that.
first.
Over a cheesecake and a donut. Okay, so what we can do is take a couple of questions on the floor, right? And there's Dr. Jason there, asking a question about the benefits of digital tools. Obviously clear. So how are you addressing the needs for those who are digitally excluded? Right, very often sit KL and watching Netflix and while stuffing our face with some food panda and stuff like that, we hardly forget about people who don't actually have smartphones and connectivity and stuff like that. But so how do you actually extend all to them? Any takers for this?
I'll go first.
Okay.
Yeah, go ahead, Kev. I mean, I'm going to give it to you. Yeah.
I just personally experienced this quite a lot when we are installing our solutions across the clinics, especially health clinics lah. Hospitals still quite okay, but health clinics really different area of the geographic really affect on how you deploy your solutions. That's why QueueMed actually the main solution we provide online appointment, mobile solutions, e-payment, all these things. We have to make sure our solution actually all to all, not just pure digital. We also have some offline component that we have to install in the clinics. So for example, with our queue system, right? The queue system is to deploy to cut down the waiting time. But if like the patients do not have mobile phone or the clinic do not have enough gadgets for you to cater for your queue system, how are you gonna deploy your solutions to help them to bring down the waiting time? How are you gonna cut down the patient's waiting time there? So that's why we had to make this kind of IoT or hardware that can actually install in a clinic. Just give an example. In the clinic, actually, we install a QTV, we install a kiosk. So for those non-tech savvy patients, they also can enjoy to get this kind of queue ticket, and they can monitor their queue status from there. And then for the clinics, like they do not have enough hardware, so we had to come up with an admin app so they can use their existing mobile phone so to tap on any resources available in the facility to roll out our solutions. Yep. Khairul.
Sure. And Dr. Khairul?
I think I've been dragged into this interesting discussion recently when I was involved in the COVID-19, task force, especially with regards to not just tracking, but also recently on the rollout of the vaccination, right? So the phase 3 vaccination rollout is going to be a massive effort, right? For Selangor alone, we're looking at 6.5 million people. And when we did a sweep on the ground, there's about 37% of these people are not connected. So how do we actually, reach out to them? Number one is I've been blessed to really get an insights on this. The state government is putting their feet down to really hire volunteers. We equip them with tools for them to enter this data, whether they go to remote areas when there's no online, they were given an offline tool. If they are on, they will be given another tool for them to enter the data for them to register these people to get vaccination. And we integrate this with the central database for Ministry of Health as well. So again, the center of all this is to get all the central database all updated. Whether it's digitally divided, digitally left behind, it's important for us to really reach out to them, again, with the right tools. So how do we do that? Like I said, right? So we give them a card, although it's physical card, but it has a QR code for them to know that, the next person who's beside them can just quickly take a QR code and see what's going on. I mean, where is their appointment? Where is the vaccination center? So that's one aspect of what we have done. Secondly, those who are involved in NCD screening on non-communicable disease. This is what Kev was mentioning just now and Azran was mentioning, about the obesity people, hypertension, diabetic people who stay really in the rural area, pendalaman. Again, the same approach. We provide them with the same platform that goes back to the central database to really enter all this data to get to them, do their glucose screening, do the blood pressure screening, and get back data to the central database. So we know from centrally which areas that we really need to tackle on, whether or not they are left because they don't have the ability to clinic kesihatan, nearest clinic kesihatan, or they are left behind because of social economic well-being, right? So when we have all this data centrally, although it sounds ideal, but definitely we are tackling this for the divided, digital divided as well. So technically, we have two teams looking at people who's really enhancing the digital experience, and another team looking at those who are left behind from digital trend point as well. So definitely, this is something that we have definitely looked into.
Fantastic, real boots on the ground, right? And so I actually want to also get perspective from Azran and Zhen Wei, right, where mental health, whether it's just my perception or what I've been hearing around, really is for, at least perceived, for the rich, right, or for the people who have insurance coverage. And mind you, Malaysia probably has like 60 to 80% of our population who's underinsured or not covered, right, from this. So how do we change that perception and make it real, right? That if and again, just to quote one of my own stats when we were running, what do you call that, screening, HB1C screening in some of the remote areas, the numbers were staggering. And it seems that the diabetic epidemic is not with the rich folks who can eat salad and meat, but it's actually with the people who really have to just eat rice and do a lot of menial work, right, and high calorie food, right, and they also lack the education. So how do we actually include them? How do we actually reach out to them? How do we actually make it affordable for them to talk to mental health professionals?
I'll start. For example, Maran, today, if you only relied on what we call synchronous communications for your therapy, right, meaning like what we're having right now, a psychologist is going to get maxed out at 50 clients a month. That's capacity. But when you start to augment them with a lot of sort of the AI-enabled tools, from natural language processing and visual recognition technologies, we've now gone beyond 600 to 1. So by doing a 10-fold in activity, you can literally say, well, instead of the price that someone in Bangsa would pay for a full therapy session, we can 10x that. And 10x is when you can suddenly create a completely different, much more affordable and accessible playing field. So that's how technology democratizes and creates much more access, right? By driving down costs significantly. That's what you see in banking, in e-hailing, in entertainment, and other services.
Great, really clear example over there. And Zhen Wei, what are your thoughts about how would your mental health professionals be open to actually talking to a Makcik Kia out there about her job loss, right? Because a lot of people are losing jobs these days, right? Or even like her struggles with diabetes and hypertension.
Yeah, so I think so Azran mentioned about the augmentation, right? Really bringing down the cost in terms of being able to get them to reach out more, and I absolutely echo that as well, and that's really important. The other part around what you've mentioned around that is really the awareness and also the stigma, right? So I think what we have done around that is really to actually create more approachable and relatable content and tools that they are able to kind of do on their own as well, right? Things that they are able to actually understand and just do within 5 minutes to 10 minutes to really just have a gauge around where they are at, right? Rather than having to wait until they reach that place, right? So we are really focused on prevention side as well, where we are actually having a lot of conversations. So let's say, like for example, when we work, so our focus is really trying to make it reaching as many people as possible, and we realize that one of the channel is actually through employers that is providing this kind of service to the employees, right? And within a big employer, for example, you will definitely have maybe not the Makcik Kias of the world, but there are actually still people that are actually similar profile to what you've mentioned. So for those kind of engagement, what we do is that on top of having that one-to-one communication or the asynchronous chat, we also then do a lot of content and also things that they can do on their own, be able to kind of reach them as early as possible, to be proactive around it rather than waiting for them to kind of raise their hand and and seek for help, right? So there's a lot of things that we do in terms of designing the interventions that is off the app and on the app itself, to be able to kind of help them to understand that actually what you're facing is not part and parcel of life. Because we spoke to some demographics that you mentioned, they just think that it's part of life. Life is just hard. right? This is just how my life is. But they don't realize there's actually steps that they can take to actually, improve their life in terms of building better habits so that they can be able to cope with more, right? So the way we position it in terms of having tools that they can actually track, we make it as simple as possible so that whenever they do have the opportunity to speak with our mental health professionals, they already have some sort of informed knowledge or awareness. Then our mental professionals will be able to kind of bridge with them in terms of where they are. Our philosophy is really around designing there's something for everyone on the platform, regardless of the readiness or maturity, quote unquote maturity of of the issue, right? So that's how we try to tackle it.
Great, and certainly hope that it's going to bear the fruits of the labor, right? And so I'm mindful of the fact that we got 10 minutes left, and we don't really have much room to wiggle beyond that. So I just want to jump into what are you doing now, and what are you going to do in the future, right? And actually going to do to in terms of technology, right, to help the HCPs, the healthcare professionals stay relevant, right, and not be replaced, and actually manage. And some of your initiatives around artificial intelligence, machine learning, cross-border telehealth, augmented virtual reality, connected device, all the cool stuff that we've been hearing happen in other industries, but took a little while to get to healthcare because of the the conservatism. So what are you guys actually doing around this, and how are you actually working with healthcare professionals to make them feel safe and include? Happy to have anyone jump in there.
Yep, maybe I start first. So
Sure.
what QueueMed has been doing, actually, we call ourselves building the very fundamental blocks in the healthcare ecosystem in both the public and also the private. So by implementing a very simple things like appointments, mobile queue, even e-payment and teleconsultation, very fundamental block for all the healthcare provider. So once we implement currently, we have both the public side and also the private side. Public side, we have more than 150 kesehatan using our appointment system. We're managing more than 200,000 appointments every single month. And the other side of us is private healthcare. So we have collaborated and integrated our solution with the Qualitas Medical Chain Clinics, which is the largest medical group in Malaysia. We do see, okay, in terms of Malaysia, right, we have two healthcare ecosystem. One is a public one, the other one is private one. And public one is heavily subsidized. So all the patients, majority of patients go to the public side. So the public side actually very flooded. So patients cannot get appointments. The doctors complain of overwork. So these are common things. Whereas in the private side, after the COVID pandemic, I think a lot of private practice have been affected quite badly. So not enough patients, not enough traffics. The bread and butter were left. So actually what QueueMed is planning to do in the next stage is bridging this, both the public and also the privates, by diverting more patients from the public side to the private side. This can actually solve a lot of problem facing by both party. Of course, this will be the initial phase. The third phase onward, maybe we can add on some in AI or machine learning intelligence to make more on like this kind of resource allocations more smarter, and we can propose to the Ministry of Health certain relevant authority from there.
Okay.
Yep.
And so to the rest of you guys, right, we're talking about future technology, right? All the school stuff, right, that you see on CSI. They were years ahead of us, right, in terms of doing all the school stuff. But yeah, how do you what kind of initiatives are you running around those kind of stuff that I've mentioned, and how you're working with healthcare professionals in terms of that?
I'll go next. I mean,
Yep.
for us, because we're obsessed about delivering quantifiable improvements, even, for example, in the area of mental health, right? And traditionally, mental health professionals have used survey-based techniques, but that can be misinterpreted. It can be, people may not actually want to disclose how they're actually feeling, right? But there's a lot of technology today where you can combine, for example, if I just analyze the conversation that we're having right now, Maran, right? Just from the camera, like we can detect, your micro facial expressions. We detect the temper and valence of your voice. So you might say, I am happy, but actually the temper and valence of your voice might say otherwise, right? And then you're now getting a lot more data points rather than just based on what actually someone says in terms of the words that that person uses, to be much more precise and accurate, not just to know what is your actual emotional sentiment state, but are you in a state of readiness to change? Because what's also important is, as a healthcare professional, I also need to know the right time that I intervene, the right time that I engage, right? And the right style of engagement. And that is going to be so much more personalized in the future, rather than just, this is the standard way that I learned from textbooks in medical school or elsewhere.
Fantastic. Dr. Khairul, anything to add on top of what you've already mentioned, some of the stuff, in terms of pushing it to cloud, in terms of the QR stuff, anything else that you're working?
I'll just take the example of COVID, because this is the ongoing situation that we have right now. The
Sure.
AI I mean, at the base of all this cool stuff, whether it's AI, machine learning, it's the heart of all this is all data, right? So you don't have data for these algorithms to work. It won't work efficiently. So what we did for the state of Selangor, we're working with another partner of ours, is if you see that they are doing community screening for COVID, the choice of the place is purely from an AI engine, right? So we did the screening, we know how many percentage of people getting positive in a certain area. The AI pinpoint exactly where is the hotspot, and that's the reason why they choose to really dig down but to do screening at the community area. And with this, we translate all this data to other incidentals. For example, how do we get mobilize people to go for quarantine centers, whether it's community quarantine centers, or which CAC do they go to, which piece should be. So all this is all already in action, right? To your second part of the question with regards to making sure that medical professionals are not obsolete, I think if you can also transfer the risk of practice to the bots, then by all means, they can actually take over the risk of malpractices to be sued by patients. But I think what we will have to do is to really get the doctors to get acquainted, get familiarized, as well as comfortable with the digital tools that all of the parties, the panelists are, giving them, and not be shying away, right? So this is really something that the doctors will have to learn. Not the, I'm talking about, I think the younger generation. I'm not trying to age shaming any certain sectors of my own professions, but like you rightly mentioned, in any perspective, there will be a certain quarters would be more conservative, and there would be certain quarters would be more digitally savvy, right? So I think that's the reason why we have to equip our medical students right before they get out of medical school, that you've got tons of tools. Naluri, for appointments, you've got QueueMed. For mental health, you've got ThoughtFull. And for your medical records, we do have a REMEDi trying to solve these issues, right? If you don't adopt it, there's no point of us trying to make you relevant, right? And there's no point for us building all this AI block to really help doctors to pinpoint where the epidemics are, where even for radiologists to make a definite diagnosis on a CT scan. So without data, this cannot move. And for this to move, the doctors as well as medical professionals as a whole will have to adopt the digital divide.
All right. So we got 5 minutes left, and I'll just jump in over here with the last questions. I'll try to merge that Q&A, right, that came from Dr. Raymond Choi and Charliza. So they said, great initiative, really to solve different pain points. What are your thoughts on interoperability? I hardly can pronounce that. And basically, how do you collaborate, right, between patients, providers, policymakers, and what do you see the government's or this role in all of this, right? So, and it's going to be a quick fire session, right? So we're going to start with Zhen Wei. 1 minute on the clock. Go for it.
Yeah, so I think all of us here are actually striving for like an integrated experience and also being able to provide the outcome, right? So I think for mental health, again, it is also much harsher when it comes to it, because you have the counselors that sit outside of the formal medical system. They are, allied hive body, and then, whatever the experience, they got to explain it all over again to the psychiatrist to be able to get medication and so on and so forth, right? So I think at the end of the day, what we're doing is that we're trying to bring the mental health professional to the table, together with the insurers and the payers, to be able to actually then give them localized data and insights around, how can we actually then be able to kind of design price products, so that we're able to actually then make mental health more accessible and affordable. And I think where the basics of it is actually like what Dr. Khairul has mentioned, is at the end of the day, data, right? So certain standards of, being able to kind of, what sort of data format we're talking about, what sort of data points that we can share, we cannot share, what is the standards there. I think that's something that will probably help us to move together and be able to kind of make a bigger impact, and just very exciting times ahead of us.
Okay, Dr. Kev, 45 seconds.
Yeah, I think the government side, for the interoperability, our country is not like a lot of countries like UK, Taiwan. They have a centralized national health records. But Malaysia, we actually still in the process of making the regulatory sandbox by the Alpha Catalyst. I think MOH already appointed this Alpha Catalyst to come up with the regulatory sandbox. But nevertheless, from what we can do is, from QueueMed side, we are actually trying to integrate the more that we can. So we don't want to be very siloed in doing just our own solutions. Rather, we want to collaborate with other party. I think we have to do this first before we waiting for the government to do anything from their end. So we welcome for more collaborations. I think it's a way to move forward, to raise our voice so the government can hear us. Yep.
Fantastic. Azran?
Explicit opt-in consents from patients.
What's that in layman's term?
Well, basically, look, the reality is you're never going to have one exact system that, flows smoothly, natural. There will always be handoffs, right? And so what we want to focus on is just making sure that if there were a handoff, it requires an explicit patient consent.
Okay, fantastic. So it's the power of the patient, right? And Dr. Khairul?
I would summarize the efforts needed for regulatory as well as interoperability to three main points. Number one, openness, right? Whether you are a regulator coming into the digital health, trying to regulate, you should have an open mindset, because I've dealt with regulators in the drug development side, right? So how FDA has adopted for newer drugs to embrace innovation is highly recommended to be replicated here. If regulators come in with a mindset of penalizing, we just want to regulate things, I think the innovation would just die off. That's number one. Secondly, all parties who are involved in digital health should also adopt an open mindset, not just keeping the data to yourself. If you have this spirit, definitely interoperability will be of second nature, right? Because that's what we did in REMEDi, right? We're more happy to work with people. The question always we ask the party who wants interoperability, right? It's a high mouthful, is, are you open to actually share this with us? Thirdly, is a clear leadership. Right? Whether when I say leadership here is obviously from top-down approach, right? So the top must understand and must embrace, and also clearly understand what's on the ground. Because we've worked both ways. I've worked with top-down approach, which things are not moving, and I've also worked from bottoms-up approach, where the questions were not answered on the ground. So that's the reason why they go for digital. I mean, that's pretty much.
Fantastic. Okay, guys. So that's a wrap. It's 3 o'clock, right on the dot. And I've been told that we need to all flash a big smile and take a photo. So everyone, thumbs up, big smile. I hope KK has taken that photo. If he has, that's all for today, and we're going to leave it to Dr. Prataban, Dr. Jin, and a whole bunch of guys, including Dr. Raymond, to take over the session. Thank you very much again, and let's catch up for some teh tarik and roti canai and nasi lemak and everything that's going to cause the NCD. Sugar-free version. Okay, we'll do that. Thanks again, everyone.
Thank you. Bye.
Thank you, everyone.